In women over 60, a heart attack often does not have the signs you might expect. Not chest pain, not collapsing, not seizures. Instead, it's just slight nausea, backache, general tiredness for a few days, or mild loss of appetite. And because these symptoms are so mild, 90% of people ignore them. Many have had heart attacks while sleeping or sitting down for tea and never woke up again. This video will help you detect 8 signs that are silently destroying your heart. More importantly, it will help you address them before it's too late. Why do women over 60 often miss heart attack symptoms? In women over 60, heart attack signs often don't resemble what we see on television. It's not a sudden, severe chest pain or collapsing in the street. Instead, everything happens silently. Just a prolonged feeling of fatigue, mild nausea, pain in the neck or back, or simply feeling unwell. Because of this, many easily dismiss these symptoms, attributing them to old age, weather changes, or stress. This explains why heart attack symptoms in women over 60 are often overlooked until it's too late. Physiologically, after menopause, estrogen levels in women's bodies drop sharply. Estrogen is a hormone that helps protect blood vessel walls and regulate cholesterol. When this natural protective layer weakens, the risk of cardiovascular disease increases. However, not everyone understands this. Many women continue to care for their children and grandchildren, worrying about loved ones, prioritizing others before paying attention to unusual changes in their own bodies. That's why more and more cardiologists are warning about silent heart attacks in elderly women. But precisely which symptoms are alarming? Let's take a closer look in the next section. Symptom 1. Unusual exhaustion. Many people think that heart attack symptoms always come with severe chest pain. But in reality, many women over 60 experience more subtle, easily overlooked signs, and one of them is unexplained exhaustion. In recent surveys in the U.S., up to 70% of women who had experienced a heart attack reported feeling too tired to stand, even without heavy work or prolonged sleep deprivation beforehand. The worrying thing is that they often dismiss it as a normal sign of aging, or a reaction to the weather, dehydration, or stress. This misunderstanding can cause them to miss the golden window of time to save their heart. Another common tendency is for women to continue with housework, caring for others, or trying to stick to their daily schedule even when their body is crying for help. For example, in multi-generational families, grandmothers or mothers still try to clean, cook, or take grandchildren to school, even though they feel heavy and short of breath inside. This habit of pushing through dangerously causes many women to ignore exhaustion. And if this condition lasts for several days, it could be an early warning sign of an impending heart attack that they don't realize. Additionally, many people don't recognize the difference between fatigue from exertion and fatigue due to heart problems. While fatigue from exercise usually subsides after rest, fatigue from heart disease does not decrease, and can even appear when you are sitting still or just waking up in the morning. Some women report feeling exhausted just walking from the bedroom to the kitchen, but they attribute it to age or lack of energy. This confusion not only delays diagnosis but also makes medical interventions come too late. Therefore, if you or a loved one over 60 experiences unusual exhaustion, especially if it lasts for several days or is accompanied by symptoms like mild shortness of breath, nausea, or dizziness, consider a cardiovascular cause instead of just blaming aging. The earlier you detect early warning signs of a heart attack in females, the higher the chance of protecting your heart. This is just the first of the commonly overlooked warnings. But there are at least 7 other symptoms you need to pay special attention to, and some of them are much easier to confuse. Let's continue to explore in the next section to better understand how a woman's heart warns her when something is wrong. Symptom 2. Mild pain or pressure in the chest area. The second commonly overlooked symptom in women over 60 is transient chest pressure, which comes and goes. It's not the intense pain many people associate with heart attack symptoms. Instead, this sensation feels like something heavy is pressing on the chest, or like a tight band squeezing the upper body. Some describe it as a mild burning sensation or slight shortness of breath accompanied by gentle pressure in the center of the chest. Many middle-aged women have experienced this feeling while doing housework, driving, or even just resting. Because it doesn't last long and isn't severe, they often dismiss it as fatigue, hot weather, or a bra that is too tight. On a healthcare forum, one woman shared that she thought she just had mild indigestion. However, only a few hours later, she was hospitalized for a real heart attack. Such mild manifestations are often brushed aside, especially when the patient can continue with their normal activities. What makes this symptom dangerous is its stealthy nature. Many women, especially after menopause, are unaware that hormone imbalances, such as decreased estrogen, can make the cardiovascular system more sensitive and vulnerable. When chest pressure only lasts a few minutes and disappears, they don't think it's a warning sign. But in reality, it could be the body's first reminder of a serious problem quietly developing. According to the American Heart Association, chest pressure in women is one of the most easily misunderstood signs. This is especially dangerous in women because they often hesitate to seek medical care. They might be prioritizing caring for their children or partners and forget that they themselves also need to be listened to. If you have ever experienced a similar sensation, even if only for a few minutes, consider it a warning bell. Don't wait until it's too late because next time, it might not be a mild sensation. Please share your experience below so others can benefit. Symptom 3. Pain in the neck, jaw, or left shoulder. The third symptom that causes many women to overlook heart attack symptoms is a dull ache in the neck, jaw, or left shoulder. This is not a location people typically associate with a heart attack, so it's very easy to mistake it for a musculoskeletal problem or simply sleeping in an awkward position. The pain is often vague. It might start in the chest and radiate up to the neck, down the left arm, or vice versa, appearing first in the jaw or shoulder, then lingering as a dull ache. Many women describe the feeling as muscle soreness from heavy lifting or a stiff neck after sleep, but in fact it could be the first signal that blood flow to the heart is being obstructed. An American woman commented on a medical forum, "I used a heating pad on my left shoulder for 3 days, thinking it was from sleeping wrong. It wasn't until I felt dizzy and nauseous that I went to the hospital and was diagnosed with a heart attack." This is not uncommon. Women over 60 often have atypical symptoms. No severe chest pain, no sweating as seen in movies. Instead, there are strange, persistent pains in the upper body, which are very easy to overlook if one doesn't listen to their body carefully. Pain in the jaw or shoulder area, even if only dull, can be a sign that the heart muscle is lacking oxygen. If you feel any unusual sensations in these areas, especially if accompanied by fatigue, mild chest pressure, or shortness of breath, do not delay seeking medical attention. And that's just one part. Another sign often appears silently for several days, even weeks, before a real heart attack occurs. That is, a feeling of extreme fatigue even without strenuous activity. We will discuss this in more detail right after this. Symptom 4. Shortness of breath or shallow breathing. This is one of the most commonly misunderstood heart attack symptoms in women over 60. Many people believe a heart attack must involve chest pain and clutching the heart and collapsing. But with women, that's not always true. One of the first, clearest signs is often not pain, but a feeling of breathlessness. And unfortunately, many people unintentionally ignore it. Shortness of breath or shallow breathing is not like an asthma attack, not like a cough or pneumonia. It's the feeling that you're not getting enough air even when standing still or doing light housework. You might feel as though you've just run a race, but in reality, you're just folding clothes, watering plants, or simply cooking. A 63-year-old American woman shared that, At that time, I was cooking in the kitchen as usual. Suddenly, I felt tired, had to lean on the table to rest. I was gasping for air, my heart was pounding, but I had no chest pain. I thought it must be the hot weather. 5 hours later, I was rushed to the emergency room for a myocardial infarction. That story is not uncommon. For men, a heart attack often comes on suddenly and clearly. But for women, it can appear with subtle, persistent symptoms that are easily mistaken for fatigue, stress, or aging. Shortness of breath is one of them. According to research by the American Heart Association, over 58% of women experienced shortness of breath for several days or weeks before a heart attack occurred, but most did not recognize it as a dangerous sign. Some women report feeling short of breath when lying down to sleep, having to sit up in the middle of the night to breathe deeply. Others think they are anemic, have low blood pressure, or are simply tired from overworking. But all have one thing in common. They don't think it's a sign related to the heart. Medically, shortness of breath occurs when the heart is unable to pump blood efficiently, causing oxygen not to reach tissues and organs. This causes the body to react by increasing breathing rate, leading to a feeling of breathlessness or inability to take a deep breath. And if accompanied by extreme fatigue, dizziness, or palpitations, it is an urgent warning that needs immediate attention. The most important thing here is not whether you feel pain, but the unusualness of your body. If something that used to be very normal, like walking to the store or sweeping the house, now makes you tired and out of breath, then that's not just old age. Pay attention, listen to your body, and don't let the silence of the symptom deceive you. Shortness of breath is not always a cough or pneumonia. With middle-aged women, it could be the silent plea of a struggling heart. Right after this, we will move on to the fifth symptom, a sign that is easily underestimated as a fleeting flu, but is actually an extremely important early indicator of an impending heart attack. Symptom 5. Nausea, bloating, or persistent burping. In middle age, experiencing digestive problems after meals is not uncommon. Many people feel bloated, nauseous, or have heartburn and assume they simply ate the wrong thing, or their stomach has weakened with time. However, there's a truth being overlooked. Such digestive symptoms can be early signs of a heart attack, especially in women over 60. A study in the U.S. noted that not a few women were hospitalized for heart attacks after several consecutive days of nausea, extreme fatigue, and bloating, but without the severe chest pain they thought was characteristic of a heart attack. Some even bought a stomach medication and took it for days before collapsing and needing emergency care. This has led many experts to warn that the digestive system can sometimes be the first to signal when the heart is in trouble. The problem is that heart attacks in middle-aged women often don't present typically like in men. Instead of chest pain, they may feel pressure in the abdomen, prolonged burping for no apparent reason, or persistent nausea unrelated to food. These pains can come after dinner, while watching TV, or even while resting, leading many to be complacent and continue delaying seeing a doctor. Some cardiologists at Cleveland Clinic have also emphasized, if you experience nausea, indigestion, or prolonged burping for several hours, accompanied by unusual fatigue, it might not just be your stomach, but your heart crying for help, especially if you have a history of high blood pressure, high cholesterol, or are going through menopause, factors that silently increase the risk of cardiovascular disease. Remember, the scary thing is not pain that is too strong, but pain that comes slowly, mildly, and catches you off guard. Don't let common digestive symptoms obscure one of the body's most dangerous warnings. Have you ever experienced any unusual digestive symptoms that you later discovered were related to your heart? Please share in the comments below. What you say could help save someone else's life. Next, we will explore another sign that is also very easily overlooked but often appears before a real heart attack occurs. Symptom 6. Cold sweats. Unexplained. In middle age, the body begins to undergo subtle but very important changes, especially in how it warns when the heart is in danger. One of the most commonly overlooked signs is the phenomenon of cold sweats that are unexplained. Many people assume that if they feel clammy, it's due to hot weather or strenuous activity. But if you are sitting and resting, not exerting yourself much, and suddenly feel a cold chill all over your body, trembling hands and feet, and sweat drenching your back, it could be an early warning sign of a heart attack. For example, a survey on pre-heart attack symptoms in people over 50 recorded many cases of unusual sweating even in cool environments or at night while sleeping. These individuals had no fever, no stress, and no strenuous activity, but their bodies reacted as if trying to fight something dangerous. And that could be blood vessel blockage occurring in the heart. The phenomenon of cold sweats when there is no specific reason is very easily confused with issues such as anxiety, hypoglycemia, or hormonal changes, especially when it is accompanied by dizziness, nausea, or exhaustion. Many people think that rest is all that's needed. However, according to the American Heart Association, this can be a manifestation of the body when the circulatory system is in disarray, causing the body to activate an emergency response by sweating coldly. If not treated promptly, this condition can lead to myocardial infarction without obvious chest pain warnings. In a study on warning signs of a silent heart attack, it was found that cold sweats are a fairly common symptom in women and older adults. This makes diagnosis more difficult because the symptoms are not as obvious as the angina often seen in men. Therefore, if you or a loved one suddenly feel cold, sweat profusely for no apparent reason, don't ignore it. Go to a medical facility for examination as soon as possible. This is also why raising awareness about the early symptoms of cardiovascular disease is extremely important, especially when you are searching for information such as heart attack warning signs, cold sweat symptom, or signs of silent heart attack on YouTube. Timely knowledge can save a life. And if you have ever experienced unexplained cold sweats, please leave a comment to share your experience. Who knows, your story might help someone else recognize a dangerous sign approaching. Next, we will move on to a symptom that is also often underestimated, but can be an early sign of a serious heart attack. Don't miss it. Symptom 7. Unexplained anxiety or panic. In today's busy life, feelings of anxiety and unease are not uncommon. But what happens when that feeling comes on suddenly, for no clear reason, and is accompanied by panic as if something bad is about to happen? Many people assume it's stress, normal anxiety, or an age-related issue. But in reality, this could be a silent sign of a heart attack that we don't recognize. Imagine a middle-aged woman in her office in the middle of a normal workday. Nothing particularly stressful is happening, but she suddenly feels her heart pounding, her palms sweating, an inexplicable sense of panic washing over her. She has no chest pain, no dizziness, just an unnamed unease. Such situations are becoming more common in people over 50, especially women, and even more worrying, many people ignore it because they think they are just emotionally unbalanced. The problem is this: when blood flow to the brain decreases, as in the first minutes of a heart attack, the body can react as if it's experiencing a panic attack. The central nervous system sends alarm signals, but those signals are misinterpreted as normal anxiety, especially for women because heart attack symptoms in women often differ from men and are rarely severe chest pain. Because of this ambiguity, many people are misdiagnosed or don't get to the hospital in time. Many cases are only identified as a heart attack after the critical danger is past. This shows that early signs of heart disease are sometimes just inexplicable emotions, not always obvious physical signs such as chest pain or shortness of breath. If you or a loved one experiences sudden, unexplained anxiety, especially when accompanied by other symptoms like mild dizziness, nausea, or a general feeling that something is wrong, don't rush to conclude it's just a psychological issue. Consider it a warning signal from the heart, especially if you have risk factors such as high blood pressure, diabetes, or a family history of heart disease. Going to the hospital for a checkup is a safe choice, and it could save your life. The better we understand the connection between anxiety and heart problems, the more capable we are of responding promptly. Don't let complacency or misjudgment make you miss the opportunity for timely treatment. And if you have ever experienced such anxiety, please share your story in the comments section. Who knows, your experience might help someone else recognize the heart's cry for help. To learn more about these vague but dangerous signs, don't miss the next symptom. Symptom 8. Difficulty sleeping, or waking up in the middle of the night. Feeling tired. In middle age, many people begin to experience sleep problems, which might seem normal due to age or stress. However, there is a type of insomnia that you should not take lightly. That is, frequently waking up in the middle of the night, especially between 2 and 3 a.m., accompanied by a feeling of fatigue or chest heaviness. Not a few people describe feeling as if an invisible rock is pressing on their chest, or a suffocating, anxious feeling for no apparent reason. In reality, this can be one of the early warning signs of cardiovascular problems. When the heart does not pump blood efficiently during sleep, the body will lack oxygen, causing sudden awakenings in the middle of the night. Some studies have shown that irregular heart activity at night can disrupt deep sleep, causing patients to wake up many times and feel tired in the morning, even after enough rest. Many people often confuse this phenomenon with age-related insomnia or blame it on late-night electronic device use. But if you have changed your lifestyle, reduced caffeine, don't use your phone before sleep, and the situation still doesn't improve, then the cause might be coming from your heart, especially when insomnia is accompanied by other symptoms like extreme fatigue, shortness of breath, or mild chest pain during the day. Another notable point is that middle-aged women often tend to endure these signs without going to the doctor, believing that it is just hormonal changes or the effects of menopause. However, data from medical reports in the U.S. show many cases of women having heart attacks at night who had not previously recognized any obvious signs other than difficulty sleeping. If you or a family member frequently wakes up in the middle of the night with a feeling of fatigue, shortness of breath, or chest heaviness, consider getting a cardiovascular health check as soon as possible. Early detection and timely intervention can help prevent the risk of myocardial infarction or heart failure in the future. Remember, sleep is when the heart needs to rest. If even during sleep the body is not at peace, then that is a warning you should not ignore. And if you have ever experienced prolonged, unexplained insomnia or woke up in the middle of the night with a feeling of fatigue, please leave a comment below. It is very possible that your experience will help others recognize early signs and protect their own health. Let's share together so no one has to go through this alone. Many middle-aged women in the U.S. are speaking out, sharing experiences they call almost dying due to complacency. In thousands of comments under cardiovascular health videos, it's not hard to find familiar stories. A dull ache in the shoulder thought to be due to muscle strain after sleeping in a wrong position. An unusual feeling of bloating after dinner, thought to be just indigestion, or prolonged fatigue mistaken for work stress. Some people admit that if not for family members forcing them to get checked, they might not have had the opportunity to tell their story. The truth is that heart attack symptoms in women are often different from men and are easily misunderstood. This causes many people to hesitate to see a doctor, leading to serious consequences. But the positive thing is that there's a new wave on social media. A surge of women are openly sharing their experiences, warning about the early heart attack symptoms they've experienced so that others can recognize them sooner. This speaking out not only helps spread knowledge, but also creates a feeling of companionship and safety. Because when you hear hundreds of people say, "I thought that too, but it was a sign of heart disease," you will start listening to your body more, responding when you see the signs. One of the common mistakes that causes many women to miss the golden opportunity to protect their lives is waiting until symptoms become obvious. However, with heart attack symptoms in women, everything often starts very subtly and atypically. You might just feel a little short of breath when climbing stairs, an unusual fatigue even after resting, or a feeling of tightness in the chest for no apparent reason. These small signs, when they appear together, are early warnings that you must not ignore. If you see 2 to 3 suspicious symptoms occurring at the same time, for example, mild nausea, jaw pain, accompanied by an unusual feeling of palpitations, call emergency services or see a doctor immediately. This is not the time to think about whether you are bothering anyone. Many American women have shared that they once felt guilty about waking their husbands in the middle of the night just because they felt uncomfortable. But doctors all emphasize that in situations related to heart health, hesitation can cost a life. More importantly, early detection not only saves your life but also helps reduce long-term damage to the heart. Therefore, even if the symptoms seem small and vague, you should act immediately. Let a proactive mindset become part of your lifestyle. Prevention for women. Over 60. Starting today. After age 60, women's hearts become more sensitive and vulnerable, especially after menopause, when the hormone estrogen decreases sharply, removing the natural protection that women once had at a younger age. That is why preventing heart attack symptoms should not wait until obvious signs appear. Acting today can make a very big difference for the years to come. The first thing you should do is have regular cardiovascular health checkups. Don't hesitate to ask your doctor about specific indicators such as cholesterol, especially LDL and HDL, blood pressure, blood sugar, and, if necessary, ask about a coronary artery calcium (CAC) scan. This is a simple test but can predict the risk of future myocardial infarction that many women have never been advised to perform. Second, maintain a healthy lifestyle gently and sustainably. No need for over-exercising, you just need to walk briskly for 30 minutes every day, or practice yoga, tai chi, and qigong. Combine this with a diet rich in green vegetables, limiting sugar, salt, and bad fats. Your heart will thank you every day. Third, don't underestimate stress. Prolonged stress significantly increases the risk of cardiovascular disease, especially in older women. Taking time to rest, connect with family, meditate, or do things you love is part of heart therapy. And most importantly, listen to your body. If something feels not normal, even if it's very small, trust that feeling. Women often have very keen intuition, but are easily dismissed because they think they are overreacting. Don't let complacency obscure signs that could save your life. If you are watching this video for your mother, wife, or loved one, please share it so they also know how to protect their heart. And what about you? When was your last heart checkup? If today you have learned something new, if your heart gently resonated when hearing those subtle signs, don't let it pass. Please like the video, share it with your loved ones, and subscribe to the channel so that together we can spread knowledge that can save a mother, a wife, a friend living next to you whom you never suspected, or even yourself. We thank you for taking the time to watch. And don't forget to explore the channel's next videos, where you will continue to receive useful health knowledge. Let your heart be heard and protected every day. See you in the next video.